So hey guys, what's up? So welcome to World News 20 News channel. So let's talk about securing front lines. Even as India ramps up production of medical gear, it must add its voice to call for the production cooperation on the matter. On April 4, Prime Minister Narendra Modi called on the country's health authorities to ensure availability of the essential medical equipment such as masks, gloves, and PPEs, personal protection equipment for doctors. PM Modi's directive at a meeting of the empowered groups constituted for planning and ensuring implementation of the COVID-19 response activities. It is significant given that concerns about the unavailability of the PPEs for doctors have been raised in the several quarters. Delhi Chief Minister Arvind Kejriwal, for instance, said that hospitals under the Delhi government are facing a shortage of the PPEs. A survey conducted by the Department of the Administrative Reforms and Public Grievances has shown a light on the voice of the district collectors and district magistrates about the shortage of medical gear. According to survey, 47% officers felt that inadequate availability of the PPEs in district hospitals is an area of concern. On February 27, the World Health Organization issued a warning about an impending shortage of the medical gear. The current global stockpile of the PPE is insufficient, particularly for medical masks and respirators. The supply of the gowns and goggles is soon expected to be insufficient. Surging global demand, driven not only by the number of the COVID-19 cases but also by the misinformation, panic buying, and stockpiling, will result in the further shortages of the PPE globally. But India has paid heed to the Global Health Agency's concern only after it issued another warning in mid-March. On March 19, it prohibited the export of the protective gear. India has also ramped up production of the PPEs. The DRDO Bangalore-based Bharat Electronics and 12 private entrepreneurs are involved in this endeavor. The center also plans to import 1 crore PPE kits by April 10. However, with global competition for medical gear intensifying, pulling of imports may not be an easy task. The chronic global shortage of the PPEs is one of the most urgent threats to our collective ability to save lives. The problem cannot be solved without international cooperation, says the World Health Organization. But in the scramble for the medical gear for frontline health workers, the agency's plea seems to be falling on deaf ears. France and Germany have accused the United States of unfair practices, paying far above the market price for the mask from the top producer China and winning contracts through higher bids even after European buyers believed that the deals had been sealed. The World Health Organization has asked countries to desist from such practice and call for the equitable distribution of medical supplies while it continues to bolster its domestic capacity to battle the pandemic. India would do well to add its weight to such voices. So if you like the channel, so kindly subscribe to it.